is our setup. Hi, my name is Julianne. I'm going to be your nurse anesthetist for the day. I'm going to sanitize my hands. I'll be doing the second part of your physical exam. Can I confirm your name and date of birth?
Corinne Schwansky, 8/12/96.
Great. Part of this exam involves me touching different parts of your body. Do you give me permission to do so?
Yes.
Okay, let's get started. I'm going to have you lay back and kind of pull yourself. Yep, exactly. So the first part of this exam is inspection. So I'm going to inspect the abdomen. Skin is intact. There are no lesions or protrusions, and no pulsations are noted, and the abdomen is flat. I'm going to use the diaphragm of my stethoscope to listen to your abdomen. Positive bowel sounds are heard in all four quadrants. I'm going to now flip and use the bell of the stethoscope to auscultate the arteries within our abdomen, starting with the aortic, moving on to the renal, and then to the iliac. No bruit was heard on any of the abdominal arteries. I would normally be listening to the femoral arteries, but for the purposes of this exam, I'm going to skip that. So next, I'm going to do percussion. So in a snake-like pattern, I'm going to percuss. Okay, tympany was heard in all four quadrants, which is a normal finding. I'm now going to percuss up to the lower border of the liver, starting at the umbilicus. I'm going to percuss to dullness. Okay, I'm going to move over to the midclavicular line and percuss to dullness. Okay, so that's a normal finding. I've percussed to the lower border of the liver. And now I'm going to move over and I'm going to percuss over your spleen. I'm going to find the lowest intercostal space. I'm going to have you take a deep breath in, deep breath out. One more time. Okay, and out. Okay, so tympany was heard, which is a negative Castell's sign. So that concludes the percussion. I'm now going to move on to palpation. So I'm going to lightly palpate all four quadrants. You let me know if there's any tenderness. Nope. Okay, I'm going to do deep palpation. Any tenderness?
Nope.
Okay, so now I'm going to palpate for your liver. I'm going to brace underneath your abdomen, and I'm going to have you take a deep breath in. Okay, out. Okay, so the liver falls on inspiration and is non-palpable, which is a normal finding. I'm going to move over to your spleen. I'm going to have you take a deep breath in and out. Okay. The spleen also falls on inspiration and is non-palpable, which is a normal finding. So that concludes the abdominal part of this exam. So I'm going to move on to your extremities. So extremities appear evenly distributed. Skin looks pink, intact, no redness or lesions noted. I'm going to use the dorsum of my hand to feel. Temperature is warm and intact. I feel no masses or any areas of deformities. So now I'm going to move on to pulses. So I'm going to palpate your temporal pulse, your brachial pulse. Going to feel for radial pulses. Okay, normally we would be doing the femoral pulse, but we're going to move on from that for the purposes of this exam. Going to feel for popliteal pulses. Okay, present. Now I'm going to feel for dorsalis pedis and posterior tibialis. so all of her pulses were felt strong, positive throughout, and we're going to move on to range of motion. Okay, so I'm going to have you flex your hip up. Yep, exactly. Great. And I'm going to have you extend down. I'm going to have you abduct out, adduct in. Great. I'm going to have you bend up your knee and yep, place it there. I'm going to have you externally rotate, internally rotate. Wonderful. And I'm going to have you now place your heel on your knee and draw a line down your shin. That tells me that cerebellar function is intact. Now I'm going to do the same set of exercises but to resistance. So I'm going to have you flex up, exactly, extend down, abduct out, adduct in, bend that knee, external rotation, internal rotation. Wonderful. So now we're going to do the other leg, starting with no resistance. Yep, flexion, extension, abduction, adduction, bend that knee, internal or external rotation first, internal rotation, put that heel on the knee, draw a line down. That's normal finding, cerebellar function is intact. So now we're going to go to resistance, up, down, abduction, adduction, bend that knee out, external rotation, internal rotation. Wonderful. Okay, so we had full range of motion with and without resistance with 5 out of 5 strength in both extremities. So now we're going to have you exactly just like that. We're going to now move on to your ankles. I'm going to have you dorsiflexion up, plantar flexion down, abduction out, adduction in, and then I'm going to have you invert, evert, yep, exactly. And then we're going to do to resistance, dorsiflexion, plantar flexion, abduction, adduction. Beautiful. Okay, so also full range of motion with and without resistance and 5 out of 5 strength. So now I think it's time for you to sit up. Okay, so I'm going to have you the same thing. We're going to extend both legs out. Yep, and flex in. And then you're going to do to resistance. Yep, beautiful. Okay, so now we're going to move on to your C-spine. So I'm going to have you kind of just repeat after me. You're going to look down, look up, look right, look left, ear down to your shoulder, ear down to your shoulder. Great, so now we're going to do all of those to resistance. So forward, back, and then out, yep, exactly this way, down, down. Beautiful. So we had full range of motion with and without resistance, 5 out of 5 strength for C-spine. I'm going to have you shrug your shoulders. Yep, to resistance. Good. This tells me that cranial nerve 11 is intact. Now we're going to do range of motion, but in your arms. I'm going to have you kind of repeat after me here. You're going to go flexion up, extension down. Yep. And then we're going to abduct out, adduct in. And now we're going to go this way, and we're going to invert, evert, bicep flexion, bicep extension. So now we are going to do all of that to resistance. So up, down, out, in, arms at your side. Try to hug yourself. Other way. Give me resistance up and down. Perfect. So now you're going to have your hands out in front of you, and we're going to do a continued range of motion with your wrists. So you're going to go up, down. You're going to supinate, pronate. Now you're going to do ulnar inversion and radial inversion. Beautiful. So now we're going to do what we can to resistance. So we're going to do up, down. So you're going to do, you already did your supination, pronation. I'm going to have you invert, evert. Great. Okay, so now I'm going to move on to your fingers. So I'm going to have you abduct out, adduct in. Great. So abduct out to resistance, adduct in to resistance. Wonderful. Okay, so you had full range of motion, 5 out of 5 strength in all of your extremities. So that's a normal finding. And now we're going to move on to the neurologic portion of this exam. So to begin, I'm going to test your deep tendon reflexes. So I'm going to move on to your right side. And I'm just going to have you kind of give me your full body weight here. This is going to be testing your tricep. Great. Okay, so that is intact. Now we're going going to test your bicep reflex. So you're gonna just kind of lay that nice and flat. Great, so that's intact. Now your brachioradial reflex, okay, intact. And now I'm gonna move on to the other arm. Okay, so again, your tricep reflex, great, and your bicep reflex. Okay, present. Your brachioradial reflex. Okay, and then I'm gonna have you kind of scoot back so that you're kind of against, a little bit more forward, so you're kind of against gravity here. Okay, we're gonna do the best we can. So you got your knee reflex, great, and then I'm going to hold the ball of your foot to test your Achilles reflex. Okay, intact. Now I'm going to test your Babinski, and I'm going to start at the lateral aspect of your foot. Great, okay, and I'm going to go this way. Great, so your toes fanning in are a normal finding, so that would be a negative Babinski reflex. So now we're going to move on to the sensory portion of this exam. So what I'm going to do, I have two objects here. I'm going to have you close your eyes, and what I need you to do is tell me the location and whether it's a soft or sharp sensation. Okay, so now you close your eyes.
Hard left forehead. Hard right forehead. Soft right cheek. Soft left cheek. Hard left chin. Soft right chin. Hard left arm. Soft right arm. Soft left hand. Hard left forearm. Soft right forearm. Hard right hand. Hard left leg. Soft left knee. Soft right leg. Hard right knee. Soft left shin. Soft left foot. Hard right foot. Hard right shin.
Okay, so the patient is exhibiting normal sensation in all 6 domains. And now I am going to test your cerebellar function, or cerebellar. So what I'm going to have you do is I'm going to have you touch your knees and alternate with your knees and your hands kind of like this as fast as you can. Okay, good. Now I'm going to have you come up, and I want you to point your finger to your thumb and alternate all of your fingers like this. Yep, as much as you can. Quick, good, okay. Now I'm going to have you do just point your finger and thumb as fast as you can. Good, okay. So now I'm going to have you go out like this, close your eyes, take your pointed finger and alternate touching your nose with your different, yep, exactly. 2, 3, 4, okay, good. So that cerebellar function is intact. Now what I'm going to have you do is I'm going to put my pointer finger in different locations. You're going to touch your nose and then touch my finger, okay? Okay, cerebellar function is intact. So now I'm going to test your stenosis, and so I'm going to have you open your hands. Yep. Close your eyes, I'm sorry, and I'm going to put 2 objects in your hand, and you're going to tell me what the objects are. So close the objects, yep.
Battery and a coin.
Okay, so her stenosis is intact, and now I'm going to test your gravesthesia. So I'm going to have you close your eyes, put your hand out in front of you. I'm going to write a letter in your palm. You're going to tell me what that letter is.
B.
Okay, now I'm going to write a number in your palm.
4.
Okay, wonderful. So that tells me the gravesthesia is intact, and that's all normal findings. So now I'm going to have you stand up, and I'm going to have you dorsiflex. So you're going to bend this way up, exactly touch your toes. Great. So I'm testing for scoliosis here. So spine has normal curvature, hips are even, and there's no bulging or masses noted. So I'm going to have you stand up, and so now we're going to do the Romberg test. I'm going to have you face yep, exactly. So I'd like you to close your eyes, and we're going to count to what would be 20 seconds. We're just going to do 1, 2 seconds for this video here. We see no swaying, which tells us that our Romberg test is negative. So now what I'm going to have you do is I'm going to have you balance on one foot. Yep. 1, 2, 3, 4, 5. Other foot. 1, 2, 3, 4, 5. Wonderful. So you were able to do that, which tells me that your balance and proprioception is intact. So now I'm going to have you face this wall here, and I want you to walk heel to toe, 5 steps forward, 5 steps back. Okay, great. So again, telling us that your balance and proprioception is intact, and thank you for your participation in our video.
Thank you.